Welcome to Reflections, a program where we discuss values and virtues for the transformation of the individual and the society in general. I am Father George Ehusani, and I'm here in the studio with me once again is Dr. Chime Asonye.
Yes, sir.
Yeah, you were here some time ago where we discussed Nigerian mental health.
Yes, sir.
Good. So, Chime is here once again for us to discuss. We have the Mental Health Act
yes, sir.
into law now. It's been endorsed by passed. And so what next?
Yes. Well, thank you again, Father, for having me on. It's so good to be have these conversations around something so important, which is the Mental Health Act. And like you said rightly, the Mental Health Act passed earlier this year. So we got recognition in January 5th. President Buhari signed the bill. But you know, like most things in Nigeria,
it's called Mental Health.
It's called the National Mental Health Act 2021.
Yeah.
So let's not get started why it's called 2021, but we've been at it for a while. So you can see when it got passed. And the question is, what next? Like most legislation in Nigeria, they just sit on the shelf, but we don't want it because people's lives, their hearts and their souls are too valuable for us to just leave it like that. So on honor of World Health Day, Nigerian Mental Health, along with our network partners like the National Association of Psychiatrists, the psychologists, medical social workers, and we co-hosted it with the National Commission for Persons with Disabilities and National Human Rights Commission. We had a press conference and we defined 10 next steps for the act, ways to go forward. And one of the things is we just need the act in our hands. We need a gazetted copy of the bill. So an official copy has been released, but it's not on any publicly accessible website. And people need to know what their new rights are. So we need to be able to find it on either Federal Ministry of Health's website or the...
Well, you have put it on your site, Nigerian Mental Health.
Yes, we have put it on our site. And if people want to access it right now, they can go. It's www.nigerianmentalhealth.org. Not only have we put it on the website, but we've put the past legislation, the past readings. We put memorandum from the bill from different actors like the National Association of Medical Social Workers, psychiatrists, etc. Because we want... There's really good ideas that were in the memoranda. And as you're implementing the bill, we want to be able to look at the memoranda and make sure that we can think through the guidelines, or is there some recommendations that didn't make it into the law that we can mainstream in different ways, etc. Not only do we have the act, the memorandum, but we also have the 10 steps that I've listed out. So our first one was we want a publicly accessible copy of the gazetted act, either on the Federal Ministry of Health's website or on the National Assembly's website. The second one is that while we have a Mental Health Act, the point of a Mental Health Act is to support those who are psychologically vulnerable. So we can't have any other laws that contradict that purpose. And one of the laws that we have is attempted suicide being criminalized. So right now, if somebody's thinking about suicide, thinking about taking their life, they have these suicidal ideations. And we want to make sure that they can have the comfort to talk to yourself, for instance, their spiritual leaders, their traditional leaders, their medical practitioners. But right now, if they do, they can be put in jail.
Yeah, but the law, I mean, the archaic law,
yes,
still says that suicide is a crime.
Yes, the penal and criminal code.
In the criminal code, suicide is a crime.
Yes.
So the issue is, how do we decriminalize
attempted suicide?
Attempted suicide.
Yes. So that is a big issue, and it's something that they were trying to originally have it as part of the Mental Health Act, but as you know, crimes and penal codes are laws. They have to be repealed by the National Assembly. They have to be approved by the president. So we've launched a campaign, Nigerian Mental Health and our partners. We have over 3,000 signatures calling for a repeal of the laws. We started conversations with the National Commission for Persons with Disabilities and the Federal Ministry of Health. Right now,
what about the National Human Rights Commission?
And the National Human Rights Commission, we're discussing with all of them. And we prepared a policy memo, it's about 15 pages, and we're going to send it to the Attorney General's office along with the Federal Ministry of Health. The Federal Ministry of Health is working on a suicide prevention plan, and we want to make sure that as part of that national framework, we mainstream decriminalizing attempted suicide.
Now, beyond law,
yes,
on the practical level in society, haven't the attitude of people changed with regards to how we view attempted suicide? I thought we have moved
Beyond that.
Beyond, I mean, that is to say, in general, I'm not saying, I know there will be exceptions, but that in general, we have moved beyond seeing anybody who attempted suicide as a criminal, as somebody to be, punished for attempting suicide. I think in general, society has moved a little.
So you're right. Society, if you look back 100 years ago, many laws, many countries, especially those who are British colonial countries like us in Nigeria, they had laws criminalizing attempted suicide. But if you look in the past 50 years, there's only about only over like 22 countries that have these laws on the books. So,
and I'm saying that even with this law still in the books, let's say in Nigeria, that attitudes have changed.
Well, I wouldn't say it, because there's a difference between attitude and what's practical. And what's practical, what is the reality is that people still get detained based on attempted suicide here in Nigeria. There's been cases, reports in CNN, in Punch, etc. Some people think that though attitudes have changed, it's a law that's not enforced. That couldn't be further from the truth.
Correct. The point is, no. It is not completely true that how many cases of attempted suicide do you think law enforcement agents get to know? What is the percentage? Chances are that 90% of attempted suicide, the law enforcement agents don't get to know. So I am saying the 90% that they don't get to know what is the attitude of people. Often, people rally around to support the person. I mean, in the last 50 years, for example, people have moved on quite a bit to begin to look with compassion with somebody who attempted suicide. Perhaps 50 years ago, it was like a horrible thing. This person wanted to take his life. I mean, deal with him. But I think there has been a shift.
I think that there's been a shift. I think that there's been improvement.
So we must work further to ensure that the law is repealed. That is decriminalized. I know, but I wanted to acknowledge. I wanted also to acknowledge that there has been some progress.
There's been progress, and there's also been progress not only in Nigeria but in Africa. So Ghana the other day, literally this year, decriminalized attempted suicide.
And therefore, the environment is ripe.
Right now, yes, for that, exactly.
This is where I'm going.
Yes,
The attitudes have pretty much changed. I mean, if you ask for signatures now, you wouldn't have problem in obtaining thousands of signatures asking for decriminalizing because our attitudes have changed. Many people now recognize that no, we need to look at people who attempted suicide with compassion. And what really
because they need support. They need support, not jail or detention. And I think you're 100% right. And that's why we hope more people will join the call. I think one of the biggest challenges is that people don't know that this law actually exists.
We don't even know.
We don't even know that it exists.
Actually, many of us are functioning with compassion. We don't think that it is a criminal
at all. But the people who know are people like law enforcement. And so we need to make sure that the folks who, you mentioned how 90% they don't hear about, but that 10% that they do hear about,
it's
serious enough because that's somebody's lives at stakes. And we need to make sure that we rally around them and we need to give them the tools. You see other countries right now, they don't arrest people who are psychologically vulnerable. They give them support. They give them help. They make sure their friends and family support them. So that's the second call, is decriminalize attempted suicide, so we give people the support that they need and help with the Mental Health Act.
So the first is gazetting this,
an accessible copy,
and making sure that people have it all over the place, just as you have it on your site. Second one is decriminalizing suicide.
Third one. The third one is we need to make sure. So we just had the National Assembly, new government here, new president, new governors.
They will take off, May 29th.
Exactly. And what do you see right now? You have transition committees that are being established, being called. People are mainstreaming what their priorities are going to be in government. You saw that even in my state, they named the 23-member transition team to push the ball to the next administration, and Alex Oti and Abia set up a 100-man committee. So you see this happening all over the country. And so this is the time when we need new governments to prioritize mental health within their transitions, within their health sector. If you look at the leading candidates, for instance, presidential manifestos, there was limited talk about mental health in all three of the leading candidates' manifestos. So what does that mean? That means that they have conversations around health. For instance, they want to increase health budgeting, but we increasingly see that there's not attention to mental health.
But part of the reason is that they themselves have mental health issues.
And
Those who put together this,
yes,
Nigerians are a highly traumatized people.
Yeah.
And the best way they think is avoidance.
Yes.
So you don't even talk about mental health.
At all.
The reason is that
they think you're crazy.
Yeah.
They think you're sick. They feel like you're possessed.
But that is evidence that many people are actually victims of mental illness.
So just to even buttress your point further, there was a study that was done by Africa Polling Institute and MANI, that's Mentally Aware Nigerian Initiative. And they found that 3/4 of Nigerians, so almost 75% of Nigerians have acute levels of anxiety, which you can understand living in this country, dealing with inflation, dealing with conflict, dealing with recession, dealing with cash swap, dealing with gas challenges. All these macroeconomic challenges that people are facing right now, dealing with elections, right? And the trauma of maybe your candidate won, your candidate lost, etc. The hopelessness, especially with younger people who felt like they put their hopes in a certain candidate or not. So,
and if you are in Adamawa and you had the supplementary election and it became even worse than the first one.
I'm telling you, you know, and that one, they're still trying to navigate how that's going to go. So people are frustrated, people have anxiety, and so people are suffering, and we don't give attention to it. We don't give the media attention that we need to it at all. So that's why we had it right after the elections, because we want to prioritize mental health on World Health Day and say that it should be this year's theme for World Mental Health Day was health for all. And when we think about health for all and we look at the World Health Organization's definitions of health, it is physical, it is well-being, right? And it's mental. So it's not just people just focus on the physical, but you can't be fully healthy if you're not healthy in your mind, in your body, in your soul,
well,
spirit,
I mean, this is a fallout of orthodox, Western Orthodox medicine that was more of symptoms
yes.
than underlying causes.
Exactly.
And so right now, medical.
Yes.
Right now, most places are beginning to look at health from a more comprehensive point of view, psychological, physiological,
yes.
spiritual, and so on and so forth. And one of those, what we promote is the integration of medical, psychological, spiritual.
I 100% agree.
In order to have well-being
altogether, yes.
So that the concept of well-being is total.
So just to buttress your point here, one of the points, just to skip down to one of the points, is that to inclusion of diverse actors within the mental health field. So the Mental Health Act speaks, speaks largely to psychiatrists. It doesn't speak to other types of disciplines.
I mean, I have talked to clinical psychologists, yes. And they are angry that this is they need to be included.
In the conversation.
If you don't include them, you are just wasting your time, because it is they who deal with people on the ground who yes. are suffering depression, who are yes. suffering this, before it gets serious enough to refer to psychiatrists.
Exactly.
It doesn't begin with psychiatrists.
Yes. So that's psychologists, but we can think about medical social workers, we can think about psychiatric nurses, we can think about clinical psychologists like you mentioned, but we can think about spiritual leaders, etc.
Yes.
So these actors, right, lay counselors, psychotherapists need to be part of the conversation going forward. And which is why we're really happy that not only did we co-host it with the Human Rights Commission, our press conference, and also the National Commission for Persons with Disabilities, but at the press conference, we had other members of these professional associations talk, including the Joint Organization for National Persons with Disabilities. It's really key that we continue to have all these people part of the conversation.
And one of the tasks that I would say organizations should work on seriously is this whole lack of sufficient accommodation of the psychological sciences, psychologists and social work, by the medical people, by the psychiatrists.
Yes,
this is something that needs to be discussed in the open.
Yes.
That we know that the psychiatrists are not so open and accommodating traditionally,
mm-hmm.
and that they need to recognize that no, it cannot just be the medical doctor working on this area. It has to involve all these people.
Yeah.
I have accompanied somebody in the U.S., a chaplain, a hospital chaplain,
yes, sir.
And seen in this Mayo Clinic, one of these Mayo clinics,
mm-hmm.
and seen that for ward round, it is the medical doctor that leads the team with the social worker with the pastor, with the psychologist,
Yes.
social worker, psychologist, medical doctor, pastor.
It's all there. It's all at the table together to help.
They discuss the patient together.
And let me even add another one that people don't remember. All these actors are important, but also those who have lived experience.
Family.
Not just family, those who have lived experience of having a mental health condition. Yes. If I have anxiety, if I have depression, right, I can connect with you and tell you about your experience and show you that you're able to live, cope, and thrive with it. And you can survive with it. And the Mental Health Act acknowledges that. One of the things that it mainstreams is that persons with lived experience should be used as peer support workers, right? Which was good. And so we need to make sure that those with lived experiences are there. Now the next one is about budgeting. Okay. We can talk all we want to talk about, but we need to have a budget. No money, what can you do, right? And there's a couple of things with the Mental Health Act that you have to be key. So it establishes 3 things. A mental health assessment committee that has people like traditional leaders, social workers, doctors, lawyers on the mental health that's supposed to make sure that people's human rights are protected. It establishes a department for mental health in the Federal Ministry of Health. And then the final thing it establishes is a mental health fund. But there's 2 issues with the mental health fund. One, the act doesn't say where the money's going to come from. Do you get me? Yes. So if you look at, like NCDs, like the Niger Delta and the petroleum hospital, it's in there. It's there. They say 3% from, it says it in there. It's very, very clear. This doesn't say it. It also doesn't say how much is supposed to be there, right? So we need to make sure that it's physically supported. We have, before the Mental Health Act got passed, the budget got passed. So what does that mean? Does that mean that for 1 year, right, no mental health fund, no budget provisions? So if we're thinking about a supplementary budget or anything like that, we need to make sure the mental health fund is accommodated. Secondly, in general, we're discussing before, physical health gets a lot of priority. So of the total Federal Ministry of Health's budget, the total budget, health is only 5%. Nigeria,
and it is supposed to be by
15%.
It's supposed to be 15%.
Yes, according to the African Union Accords Abuja Accords that we signed on to.
Abuja Accord, yes, 15%.
15%, and of that, so right now we vacillate between 3 to 5% of the entire total budget.
We have not crossed 6. I thought it was 6.
No. The last analysis. So that 6 that you're even thinking about came out before the final budget. Because there was a discussion that it was 6%, but it wasn't. That was the proposed budget. The final budget is less than 5%, so it's around 4.9%. And then if you look at that's the total budget. Now, if you look at the mental health specific to the health budget, guess what that is? I'm sure you'll be surprised.
1%.
It's around 3%. Around 3%.
3% of
the entire health budget.
Of health budget.
The entire health budget.
3% of the 5% of Nigerian budget.
Yes. So
that is
so
next
bad.
to nothing.
So when you think about parity, right? Parity means adequate budgetary allocation. So even if it's not 50%, at least it shouldn't be negligible. And the problem of that 3%, around that 3%, most of that goes to the hospitals and drugs, not to the things you're talking about, peer support groups, wellness programs, right? That you guys were
psychologists, something.
Do you get what I'm saying? So all these things that you guys were promoting recently at your psycho-spirituality institute, trauma healing, right? Whether it's wellness, whether it's support groups and things like that, those things aren't funded. They're not part of that 3% of the entire mental health budget.
Let me ask something. This is slightly outside.
No problem.
Countries where they manage to have budgetary allocation close to United Nations standard minimum, like education 26%,
yes,
health 15%. How do they manage and still run the country? Because I'm asking myself, if education is supposed to be 26% and we are spending 7%,
yes,
health is supposed to be 15%, we're spending 5%,
yes.
So where is our money going relative to other countries?
Well, the proof is in the pudding, right? If you look at the World Happiness Index, Nigeria, we're in the bottom third. We're number 95th, right? If you look at some of these countries where they support things like education and other human development index, and Finland, you see that the population is happy. They live longer, right? There's social services provided, and they save money because in those countries, if you're unemployed and things like that, they give you checks, or you don't end up in prison and things like that, right? They support their citizens by other social provisions. But here, we don't do a lot of those things, right? We don't have, like, even insurance doesn't cover things like mental health, right? We're not providing a lot of social services. So we have the wrong budgetary allocations. And I think that it's, if you tell me what your priorities are, it's what you budget for.
Yes.
So that means that if we budget less than 5% for health, right? And we less of that 5% is almost 3% for mental health. And of that 3%, it is it's actually 0.001 for anything that's not doctors and hospitals. That means you're saying that
it's not important.
It's not important, which is one of our another one of our next steps. We need to mainstream psychosocial support, not just biomedical support. It's not just you're having a mental health issue. Oh yeah, take these drugs.
No, psychosocial support.
We need
to know whether you have shelter, whether you have food to eat, whether you have social support. We need to know. That is important.
And when you're saying that psychosocial support and what is necessary, that leads us to another one of our next steps, which is nothing about us without us. Nothing about us.
We need to be included.
We need to be included. So what does that mean in practice? We have a Mental Health Act in name and in law. Let's create an implementation committee. As we create an implementation committee, the people who should be on that committee should be persons who have lived experiences, so they actually know, they've dealt with these issues and they know how to confront it.
They know what the challenges
are. Persons with disabilities. We should also have civil society, right? Whether it's church, faith leaders or those who are running psychosocial support initiatives, include us, create an implementation committee, etc. And this is not arcane. We just had a startup act passed, like we just had a startup bill. And after the Startup Act was passed, they created an implementation committee with various actors so we can understand, okay, now that we have this law, how do we implement it? The hard work is not passage of the law, even though it was a challenge because it took us over 2 decades. The hard work is how do we implement this law? 90% of policymaking is in enforcement, in guidelines, and implementation. So we need to make sure that nothing about us without us. Let's have persons with disabilities. Let's have civil society. Let's create an implementation committee going forward. I mentioned psychosocial support. Then the other one is, how do we define success
in this new
regime? How do we define success for the Mental Health Act? Is it that suicide rates have dropped? Is it that there's more psychosocial support that is there? Is it that we have new policies? Is it that mental health is at the primary healthcare level, like
it's been mainstreamed properly?
Yes.
There's greater awareness.
Yes. And who's responsible
to ensure
these things? What is the role of the Human Rights Commission? What's the role of the Federal Ministry of Health? We need to understand these things going forward. And just because we think that mental health is such an issue at the grassroots, we've actually made that a provision of the next steps. Is mental health at the community level? We need to make sure that people can access it, whether it's trauma counseling or other basic things. And then finally, we have a National Mental Health Act. Only 2 states in the country currently have mental health legislation. That's a Lagos and Ekiti state. It's wrong. We need to make sure that we domesticate this mental health act in every state going forward. Now, there's some states are starting this conversation. Oyo, for instance, has a bill that they're looking at, but other states need to get onto it. They need to prioritize mental health, and they need to make sure they domesticate the Mental Health Act going forward in the future.
Yeah, so they don't need to begin all afresh with a bill and so on and so forth.
No.
They just need to domesticate
the act. But if they domesticate it, they should look at the local context and also make sure that we mainstream things going forward.
And have budgetary allocation.
Budgetary allocation. Let's make sure we mainstream things like psychologists and lay counselors and peer support networks in these domesticated versions. I think that there's a big issue with the fact that we have a Mental Health Act, which we're glad that passed because it inaugurates a new human rights doctrines. And then also the old act is archaic, the Lunacy Act, thought of people as crazy. People could be detained without giving care. So we're glad that it passed. But right now, there's a separate psychological bill.
Yes.
And there's a question right now about where that bill is. Some people are telling me it's at the National Assembly. Some people are telling me it's with the president. We're not quite sure. But that is supposed to help inaugurate a new regime in terms of guidelines for psychologists and psychological care.
On that note, we will be bringing this program to an end. We pray that this 10
next steps.
Next steps.
Yes.
That more and more people will be aware of it, and people in positions
of power,
people in positions of power in parliaments of all the states,
yes.
To domesticate it in the national parliament, to ensure that budgetary allocations, National Office of National Planning,
yes,
the Budget Office of the Federation, to ensure that there is advocacy to ensure that this is planned. Then the Ministry of Health itself, not to see mental health as an appendage in their
planning,
in their planning,
yes.
and in their budgetary allocations,
yes.
each year, and so on and so forth. And also we pray that the psychological care bill also will soon be passed, so that it can complement the 2021 one.
Yes.
Then we have a more comprehensive situation.
Yeah. Well, if people want to get involved in terms of key next steps, they can go on our website. Like I said, they can access www.nigerianmentalhealth.org. They can go on the website. They can learn and read about the Mental Health Act. They can also come and sign our petition for decriminalizing attempted suicide. And just these 10 steps that we can be discussing, we have it more elaborated. We have it with stats and statistics. It's signed by over 40 organizations, including the 4 leading professional mental health organizations in the country. So there's large consensus on these next 10 steps.
Great.
And we want people to buy in, so we can make sure that the Mental Health Act isn't just something we talk about. It's something that makes an impact in real people's lives.
And Nigerians should take this seriously, because our own findings are that Nigerians are all going around with mental illness. I mean, that's the truth.
Yes,
we are
sir.
going around with mental illness, particularly psychotrauma.
Yes.
People are not stripping themselves naked on the street. Doesn't mean that we are not sick.
Yes.
On this note, I say thank you, Chime, for the work your organization, Nigerian Mental Health, is doing, and these next steps, 10 next steps, so as to properly domesticate this and make sure it works.
Yes,
and may the Lord ensure success for us.
Thank you so much,
Thank you for coming.
Thank
God
you for
bless
the invitation,
you.
sir.
Thank you.